Hello and welcome to the next segment on this ghoulish broadcast, The Wheel of Wicked Wounds. And with me once again is the Witch of Wounds, Sharon. Hello, Sharon.
Hi, Jeff. How are you?
I am great. Are you ready to spin this Wheel of Wounds again?
I am. I'm anxious to see where we end up today.
Now, don't forget, Sharon, you are spinning for a contestant in the audience, so
Yes.
Let's spin well.
All right, here we go. You ready?
I am ready. Around and around we go. We're not sure where we're going to end up.
There we are. We're at wound infections. I'm very excited about that one.
Infected wounds are a very important part of clinical practice, and we're going to be discussing that in the next segment. Sharon, I believe that presentation is yours.
You are absolutely correct. We're going to be talking about wound infections.
Wound infections. But before we get there, we have contestants out there. Sharon, you were spinning the wheel for some contestants that submitted their names corresponding to the Wheel of Wicked Wounds, and we have a contestant that submitted for infected wounds.
Great. Let's see who the winner is.
Find out who it is. May I have the envelope, please?
Ooh, here it is, floating in. Get it. All right. Who's
Sharon,
our
would
winner?
you like to do the honors?
Okay, we will see now. Andrea McIntosh
Andrea.
from Joliet, Illinois. Congratulations.
Congratulations, Andrea. You are the winner of WebCME's feature program, Wound Care Bootcamp. We'll be contacting you for your free subscription, Andrea. Congratulations, and thank you for participating. Sharon, are you ready for your presentation?
I sure am.
Let's take it away.
Take it away. Infection and bacterial burden. That was our selection today on the Wheel of Wounds. The effects of the presence of bacteria in wounds is very complex. Our body is in constant contact with multiple organisms originating from endogenous and exogenous sources. These microorganisms are usually present without any evidence of infection because a balance exists between the host resistance and microbial growth. Infection occurs when this equilibrium is upset, either because of lowered host defenses or increased microorganism quantity or virulence. Wounds present an ideal environment for bacterial growth. They're moist, they're warm, and they have reduced oxygenation. Virtually all chronic wounds contain bacteria and are considered contaminated and/or colonized. Let's take a closer look at the terminology of bacterial balance and bacterial damage. Contamination is the mere presence of bacteria on the wound surface with no multiplication of bacteria. You will see this in all types of chronic wounds. Colonization is the replication of microorganisms on the wound surface without invasion of the wound tissue and no host response. In other words, colonization is a steady state of replicating organisms attaching to the wound surface and multiplying, but they are not associated with tissue damage or delayed healing. If bacteria continue to multiply, critical colonization or local infection may develop. Critical colonization is a state where host defenses are unable to maintain a healthy bacteria balance, and bacteria are sufficient in number to delay healing but not cause a classical host response such as redness, heat, or swelling. So the first sign that you may see is delayed healing with no change in wound measurements. Exudate may increase, either clear or serous on the surface. It may increase at this stage as an inflammatory reaction to the surface tissue damage. Other signs might be bright red, exuberant granulation tissue that bleeds very easily. Necrotic tissue may begin to form, and odor from bacterial byproducts may also be present. Systemic wound infection is a serious concern and is defined as the invasion and multiplication of microorganisms in wound tissue beneath the surface of the wound, resulting in pathophysiological effects or tissue injury. Of particular importance in this definition is the fact that invasion and multiplication of microorganisms occur in wound tissue. Thus, for an infection to be present, the microorganisms must be present in viable tissue, not on the surface of the wound, not in the necrotic tissue or the slough tissue, but under the wound surface in viable tissue. As bacteria and associated host inflammatory responses spread to deeper and surrounding tissue, tissue damage results. The wound may be painful. It may begin to increase in size, with potential for new areas of breakdown to occur. Additionally, you may see an increase in temperature and bone exposure. Exudate may now transform from clear or serous to purulent or hemorrhagic. Increase in erythema and edema, as well as a sweet or putrid odor from associated tissue damage, may be evident. At this stage, a tissue biopsy or fluid or swab culture should be taken to quantify appropriate systemic treatments. In review, let's look at some of the key elements of wound infection. Bacterial balance and bacteria damage should be viewed as part of a continuum that includes contamination, colonization, critical colonization, and wound infection. Infection occurs in wound tissue, not on the surface of the wound bed. It occurs in viable tissue. It is caused by invasion and multiplication of microbes and is manifested by a host reaction and/or tissue injury. What are some of those classic signs and symptoms of infection? The most common are increased pain in the underlying wound area, erythema, edema, heat, serous, sanguinous, or purulent exudate, delayed healing, discoloration of granulation tissue, friable granulation tissue that bleeds easily, pocketing at the wound base, foul odor, and wound breakdown. Keep in mind that the first 4 signs are also known as signs of inflammation, which can be elicited by tissue damage unrelated to infection. Unlike acute wounds, these classic signs and symptoms are not always present in chronic wounds. This may be due to diminished systemic or local inflammatory responses, such as with diabetic patients or those with peripheral vascular disease or autoimmune disorders. So what are the best practice recommendations for managing wound infection? Well, first and foremost, we need to identify and correct the underlying cause and cofactors. We need to assess the wound, the ability to heal, decide whether it's healable, maintenance, or non-healable wound. Use topical antiseptics or antimicrobials for maintenance and non-healable wounds. Your goal in these wounds is to decrease bacterial burden and prevent it from spreading. Determine bacterial balance: contaminated, colonized, critically colonized, or full infection. Early identification is crucial to wound management. Assess wound pain. It may be an indicator of wound infection. Be sure to look at your cultures and have them guide your treatment decisions. Debride any devitalized tissue as appropriate. Select appropriate topical treatments for superficial infections. Select appropriate systemic treatments for deep infection and surrounding skin compartment infections. Wounds should be assessed at least once a week and again at the second week and 4 weeks later. If there's no improvement, reassess the situation and start again. Discontinue antimicrobial treatments when wounds is in a bacterial balance, unless the patient is immunocompromised and in need of long treatment regimes. In summary, the diagnosis of wound infection is again complex. It should be made clinically through a comprehensive assessment, through laboratory reports, histories and physicals of the patient, and identifying antimicrobial agents based on culture results that will help treat the wound. And remember, no one clinical sign is sufficient to indicate the presence or the amount of bacteria in a wound.
Sharon. That was an excellent, informative lecture, as always. Stick around for Wound Care Workbench.